Can a bubble study diagnose PFO in stroke patients? Imagine a tiny opening in the heart that might be causing strokes without obvious reasons. That's what a patent foramen ovale, or PFO, is. It's a small flap between the heart's upper chambers that can sometimes let blood clots pass from the right to the left side. If these clots travel to the brain, they can cause a stroke. To find out if a PFO is involved, doctors often use a special test called a bubble study. A bubble study is a type of echocardiogram, which is an ultrasound of the heart. During the test, a doctor injects a sterile saline solution mixed with tiny bubbles into a vein. These microbubbles travel to the heart. If there is a PFO, the bubbles can cross from the right atrium to the left atrium through the opening. This crossing shows up on the ultrasound, confirming the presence of a right to left shunt, which is a pathway for blood to bypass the lungs and potentially carry clots to the brain. There are two main ways to do a bubble study. The first is a transthoracic echocardiogram, or TT, where the ultrasound probe is placed on the chest. It's less invasive but also less sensitive. The second is a transesophageal echocardiogram, or T, where a probe is inserted into the esophagus to get a closer look at the heart. T is more sensitive and better at detecting small PFOs but requires sedation and is more invasive. This test is especially useful in patients who have had a stroke with no clear cause, known as cryptogenic stroke. In these cases, finding a PFO can influence treatment. Some patients might benefit from procedures to close the PFO, which could reduce the risk of future strokes. However, in patients with strokes caused by other factors, a bubble study might not change management and could lead to unnecessary testing. While bubble studies are generally safe, they are not without small risks. Rarely, some patients might experience mild complications like a brief ischemic event during the test, but these are uncommon. Doctors always weigh the benefits and risks before recommending the procedure. Another method to detect a PFO is transcranial Doppler ultrasound, which uses ultrasound through the skull to identify bubbles reaching the brain's blood vessels. This can be an alternative or complement to echocardiography. Current guidelines suggest that bubble studies should mainly be used in younger patients with cryptogenic stroke and no other clear cause. This is because evidence shows that closing a PFO in these patients can help prevent recurrent strokes. For patients with known stroke causes, such as large artery disease or heart rhythm problems, the test might not be necessary. In summary, a bubble study is a reliable and well-established way to diagnose a PFO in stroke patients, especially when the cause of the stroke isn't clear. It helps doctors decide on the best treatment options to prevent future strokes. However, like all medical tests, it should be used thoughtfully, following current guidelines, and always with personalized medical advice. If you or someone you know has had a stroke and there's concern about a PFO, consulting a healthcare professional is the best step to determine if this test is appropriate.